Okay, well, welcome everyone to our third conversation on COVID-19 and the impact on healthcare for marginalized communities. I am with Civic Bootcamp, or Seattle City Club, the Civic Bootcamp coordinator. If you don't know, Seattle City Club is a small nonprofit in Seattle that works to strengthen our community through conversations with community leaders on critical topics like this one today, and encourage civic engagement. Like many organizations nowadays, we've had to shift our programs to an all online format, programs that we normally would charge for. So please consider supporting us to continue programs like these by making a donation on our website, seattlecityclub.org/donate now. And we'll put that link in our Q&A or the chat box. We've got a great conversation lined up, 45 minutes of Q&A with me and the panelists, and then 15 minutes of Q&A with you and the panelists. So speaking of, please use the Q&A button at the bottom of your screen if you want to talk to the panelists, and use the chat box if you just want to chat with other participants. We will be monitoring the Q&A box. You can upvote a question as we go, and you can keep track of what's been answered and what other questions are out there. So I will monitor that and ask the participants, or ask the panelists at the end, near the end, 15 minutes to go. So yeah, so that's about it. So I'd like to jump right in to our conversation today. Why don't we start with Abriel, if you wouldn't mind introducing yourself and your organization, what you do in general.
Aishka. I am the granddaughter of Vincent Johnny and Mary James on my Cowichan side, which is First Nations up in Canada. And I am the daughter of Abraham Johnny and Deborah Noon. I am Cowichan and Tlingit. And I just wanted to share a little bit about my traditional introduction, is that I'm the last person. My name is Abriel Johnny, and that's the last thing that's said in traditionally. And I work for HealthierHere, which is an accountable community of health covering King County. And I am the community and tribal engagement manager. And so essentially what I do is ensure that the community voice, as well as the American Indian Alaska Native voice, is embedded in the decision-making process that affects the health and wellness of King County community members, including tribal nations.
Great, thank you, Abriel. Huma, could you briefly tell people who you are and what you do?
Sure. Hi, I'm Huma Zarif. I'm a staff attorney with Northwest Health Advocates, and we do statewide health policy for Washingtonians. And recently, we've been focusing on making sure that marginalized communities have access to testing and treatment related to coronavirus.
Great, thank you. We'll be jumping more into that, talking more about that in a second. Giselle, can you give us a brief introduction?
Hi, my name is Giselle Zapata-García, and I wear a lot of hats. So today I'm representing King County Promotores Network, and we are a group that whose mission is to support advanced connectivity and partnership between bilingual, bicultural promotores and community service partners in King and neighboring counties. And so we focus on maximizing opportunities, supporting initiatives focused on elevating equity, race, and social justice in bilingual, multicultural communities through learning, sharing, and intentional networking. Thank you for having us.
Great, thank you. Abriel, before we get into the COVID-19 discussion in particular, I was thinking it would be good to have a little background. What is health equity and health disparities? We've been hearing a lot about that, especially nowadays. But what is that, and how is that important in your work?
Yeah, it's very important in my work. Health disparity is the historically underserved communities that are have a wider gap in the health inequities that they are facing, and health equity is trying to support those communities that are facing more barriers whether that's social determinants of health or the way that they're treated or approached in the healthcare system. And it's extremely important in my work because there has been a long history of federal policies, of anti-Indian federal policies that have affected the health and well-being of tribal nations and urban-based Native communities, all the way from the Indian Removal Act in 1830, which removed all of the tribal nations away from their traditional homelands, which essentially removes them from their traditional food bases. It removes them from their land base that they know how to navigate, and they were removed to land pieces, land spaces that did not have adequate fertile ground to grow crops. It did not have the game that they're used to hunting, or the traditional berries or herbs that they're used to gathering for their diet. And so, as well as affecting or causing a long line of historical trauma. And so it's important for my work to try to bring that to light and make sure that they're included in the decision-making process, because as sovereign nations, our tribal governments and our urban-based tribal leaders know how best to break that chain of historical trauma, how to soothe our emotional distress from that trauma, heal our heart, and make well-balanced of our physical health. And so making sure that they're included in that process is very vital to correcting those inequities.
Great, thank you. Huma, how would you answer that question? How does health equity, health disparities factor into your work at Northwest Health Law Advocates?
Yeah, so it's very integral to our work because we're advocating for access to healthcare coverage and healthcare services for historically marginalized communities, similar to what Abriel was just describing. So folks who are lower income or communities of color or immigrants, these sorts of folks, these different factors that historically have disadvantaged folks in accessing healthcare. And so pursuing health equity is, trying to ensure that everyone has access to healthcare and services on the same basis, regardless of these factors, that I just mentioned.
Mm-hmm. Great. Giselle, how about you?
So I actually wanted to share the World Health Organization's definition to make sure folks really understand what health equity is. And it's the absence of avoidable, unfair, or remediable differences among groups of people, whether those groups are defined socially, economically, demographically, or geographically, or by other means of stratification. And in the many years of community work that I've been involved with, and many other community workers and promotores, you see firsthand the injustices that occur to this day, whether it's because of your immigration status or economic reasons. There's so many continued disparities in our communities, and especially with immigrant and refugees. And so we feel it's really important to really try to move the dial. And we know that we have to do it in different levels. And so that's why I love that you have other panelists, such as Northwest Health Law Advocates and HealthierHere, because it's part of a system that that it needs to work together to be able to make the change that we need to see. So thank you.
Great, thank you. So Abriel, let's jump into the COVID-19. So how is the COVID-19 outbreak impacting the communities you work with, and what is your organization's kind of response to what's happening with COVID-19?
Thank you. Yeah. So due to the many anti-Indian acts that have happened through federal policies over the years, it has caused a lot of historical trauma, which lead and attacks on the environment and attacks on sovereignty and the ability to gather our own food or defend the environment that we feel is, it's all connected to our culture and our traditional diets. And so the impact of attacks on salmon make it difficult for our elders, who are very vulnerable right now, to get access to those first traditional foods that bring their baseline of wellness up to a certain point, to when, if they do come in contact with COVID, they have a higher baseline of wellness due to all the nutrients that they're getting from a first food diet. And it's clear that a lot of, COVID is just highlighting a lot of these inequities that were already present in the system through policies and through the healthcare system. So not having access to traditional diets, having, the impacts on climate change have made it difficult to get traditional medicines. There's a shortage of sage. There's a shortage of a lot of our traditional herbs and medicines that we use to make traditional teas to help support our immune system for our elders and for our tribal members. And like I mentioned before, historical trauma and the removal from traditional land bases has caused a historical trauma that's trickled. And Native Americans were never homeless before 1942. And we make up 1% of the total population in King County, but we represent 10% of the homeless population. And so that disparity it amplifies what our community members are facing. If they are out on the houseless, they can't social distance. They don't have as much access to washing their hands or that typical hygiene that a lot of us take for granted. And so a lot of our community members have, our community partners, such as the Chief Seattle Club, have been out there 7 days a week, making sure that our homeless community, our American Indian, Alaska Native, houseless, homeless community have access and somewhere to wash their hands. It's the community jumping in and checking in on elders, dropping off groceries. And what HealthierHere is, have authentic engagement with tribal nations and with the urban-based community prior to COVID happening. And because we were able to do that work prior to this, we were able to have an understanding of what tribal communities needed. And we've been hearing that we need to support traditional medicines for tribal communities. So traditional medicines and everything that encompasses. So HealthierHere, within a week, created and scoped a traditional medicine org fund. And we provided over $100,000 to 8 different orgs, Native American-led organizations within King County, to fund traditional medicines in every way that they see necessary to use those funds, to provide teas and drop off traditional medicine care packages to families so they can create those teas that help to support the immune system, and to help support sharing of the teachings. So an herb is just an herb until you have the connection and the teaching, the lesson on how to use it, how to create it, when to use that medicine, as well as checking in and on our elders and supporting them in any way they need. So as I mentioned before, there was they're dropping off grocery lists, and they are dropping off groceries to elders and trying to make sure that they're getting as much of those first foods as they can, trying to make sure they're getting salmon, trying to make sure they're getting all the natural nutrients that they need to increase that baseline. Have
you seen any infections among the COVID-19 infections among the Native communities? Have you seen that happening?
Some of our organizations have mentioned that they have heard of a few cases, and they are supporting those. I was notified that all of the families that have been receiving traditional medicine care packages from the beginning have not had any cases of COVID. So those that have been receiving those preventative wellness medicines, traditional medicines, haven't come down with a case yet.
Great. Well, thank you. Huma, what would you say is the impact of COVID-19 on your work, the outbreak, and what you've been doing? How have you had to shift?
Yeah, and so we work in health policy, so this has just taken over a lot of other projects that we were working on, but it kind of just dovetails, what we had already been working on, because this COVID-19 is just exacerbating existing health inequities. And so populations who historically haven't had access to healthcare services or coverage are being really hard hit by the COVID pandemic. So for instance, communities of color that make a smaller percentage of the state population are overrepresented in the number of cases within that population. And Department of Health has made this data available within the past couple of weeks, and they're updating it fairly regularly. And so some of the other things we've been working on are the different agencies like the OIC and Health Benefit Exchange and HCA, the Healthcare Authority, have been working on different measures to try and expand access to care during this time. So for instance, the Health Benefit Exchange has created a special enrollment period for folks who are eligible to access health care insurance through the state exchange, the Health Benefit Exchange. There's a special enrollment period that was originally open through April 8th, but has been extended through May 8th. So anyone who chose not to or didn't enroll in coverage in the regular open enrollment period now has an opportunity to do so. And also the Healthcare Authority has been putting out publications around accessing Medicaid coverage, because now a lot of folks have been impacted economically, and so their incomes may have been impacted, and so they may be eligible, they may meet the income threshold for Medicaid, and so are encouraging folks to look into that. And so we've been working with the agencies to make sure that these communications are made available in different languages and that they're being shared out to those communities. And also, like the Alien Emergency Medical Program has now, the HCA announced that it's going to be covering the cost of testing and treatment, as well as in an outpatient setting. So typically AEM is covering care for some specific finite types of healthcare issues in a hospital setting. But this state amendment, essentially at this point, the state has decided to change it to ensure coverage like on a telehealth or outpatient basis, so folks don't have to go into the emergency room to get that testing or treatment, so that we can leave those resources for the folks who do need them. And so these sorts of things, but making sure that that information is getting out. There are still quite a few gaps. For instance, Alien Emergency Medical only covers folks up to 138% of federal poverty, but we know that there's a lot of folks who are above that income threshold, but still low income and unable to pay for care. And so we're working with the state and trying to have conversations around bridging that gap with some of the federal funds that are going to be coming to the state to make sure that some care or some sort of coverage is offered for this population that has no other option. And so things like that. And making sure that folks are aware that charity care is still available. Nothing has changed around that. But the other issue is just folks are scared of accessing services because there's been a lot of other anti-immigrant sorts of policies and communications and just language that's been thrown around from the federal administration. So there's just this hesitancy in a lot of communities and fear to you know, apply for access services or even go into a healthcare facility or things like that. It's not just like policies like public charge, you know, that make people fearful of accessing public benefits, but also things like increased ICE raids and fear of, you know, being separated from your family or deported. These sorts of things have really led to, you know, what's called the chilling effect. And so folks are choosing not to access services because of fear of these, you know, immigration consequences.
Yeah. Well, thank you. Thank you, Huma. Giselle, how about you? How has COVID-19 impacted your work with the Promotores Network?
Sorry, almost forgot to mute myself. So we actually have seen a huge impact because of the larger percentage of folks that are undocumented and not eligible for unemployment or the stimulus. And so promotores and community health workers who are largely still volunteering their time to try to help the community, it's really coming together and try to figure out ways to help the community from where we're at. There's the issue of no income coming in to being able to pay the bills, the issues around several generations living within the same household, and how do you isolate somebody if you're in a small space. Some of the things that Huma mentioned around public charge, and then most recently this week, I was helping somebody who I was trying to encourage them to get the test, and he was just really concerned around stigma and how will that impact him and how people look at him and how they'll treat him. And so there's a lot of concerns in the community. And then the other one that I brought up is earlier on, there's health systems that are kindly offering virtual visits to determine whether you need to go to the emergency room because of the symptoms you're encountering. And all of those are only being offered in English. So you can't even access that if you're a non-English speaker unless you use your own interpreter, which is not something recommended. We should be really encouraging certified interpreters, both for the healthcare provider and for the individual who has concerns. And so in terms of addressing these things, there's a lot of great community partners that are also coming together to create funds that are helping those who are not eligible for unemployment and the stimulus. There's a lot of great work behind Public Health Seattle and King County to provide materials, messaging, and communications in different languages. And there's just still more work to do, but it is helping that folks are coming together from different sectors and really trying to figure out ways to ease the challenges and burdens that our community is facing. And so some of the promotores out in the community are part of the same situation that they're in, but because we have so many amazing promotores and community workers out there that really are leaders within the community, they're putting the community first and wanting to make sure that that everybody is able to get to the testing they need and the healthcare that they need and the resources such as food and rental assistance and the programs that are coming out. We're really fortunate in King County that there's a lot of resources to try to get connected to. Thank you.
Giselle, how are people, the healthcare workers, how are they reaching out to the community, especially now that people are staying at home and probably, you know, social distancing, and maybe people lack access to perhaps internet or other means? Can you talk about that?
Yes, what I've been seeing is there's been a lot of using of telephones. A lot of folks that are from immigrant communities have smartphones and use WhatsApp. And so there's groups within WhatsApp that's one way to communicate through text messaging, social media, and phone calls. There are small numbers of folks that are risking going out to, say, volunteer at a food bank, for example, but they still follow social distancing guidelines and use masks and so forth.
Okay, thank you. Just want to remind people that you can ask a question in the Q&A little button there. So feel free to do that. I'll jump into that in a few minutes. But going back to Abriel, I'm curious, kind of the same question I had for Giselle. How do you access folks who may not have access to the internet or resources, or may not be kind of connected on the you know, the social network that we have nowadays? Or is that an issue?
Yes, thank you. It is. So elders are highly valued within our culture, and many of them may not be as tech savvy. And so a lot of our community-based organizations are taking it upon themselves to order lunches and dropping them off and doing a quick check-in, and while following social or physical distancing. But doing a check-in on elders and dropping off food to make sure that they have fresh food to eat, as well as dropping off potentially frozen dinners to ensure that they have something throughout the week to eat in case they are elderly, as well as suffering from underlying health conditions and make it difficult to go to the grocery store for themselves. So our orgs are doing in-person check-ins as well as on the phone on a regular basis, and having a calling trees. They're having texting trees, and as well as trying to contact those that might be younger generation, because many of our households are multi-generation households. So relying on those that might be more used to using technology on a regular basis to assist with telehealth check-ins, assist in cultural exchanges that are now happening, or cultural traditions, practices that are now happening over video conferencing or Zoom technologies, to ensure that the spirit of our elders is still being fostered and well taken care of, because it can affect the emotional and mental health of many of our tribal members to lose access to the culture that would be happening right now if we weren't on a lockdown status. So now would be a time where many of our tribal members would be attending social gatherings for cultural events such as powwows, or planning for canoe journey, which is also includes a healing base to its program, and is supportive of those that might be in recovery from addiction. So making sure that they have access to drum circles or healing circles, and so calling on those generations, multi-generations, and calling on those younger generations in the family to ensure that there's access to the entire household.
This is a little bit, I haven't prepped you with this question, but I'm wondering what you would say we can learn from like Native wisdom about dealing with something like this, something like a pandemic. Is there some lessons we fail to learn from, or we should learn from tribal wisdom?
I would say that our culture promotes an overall well-balanced whole body wellness. And so that's, we measure that through emotional wellness, mental wellness, physical, and spiritual. So everything has to work in harmony. And I feel like the westernized healthcare system is much more of a reactive form. And our culture promotes a preventative form. So ensuring that we have those fresh foods, ensuring that we're checking in and making sure that people are emotionally well and happy prior to something, a emotional deterioration. So it's much more of a preventative approach. And I think that that's something that's an approach that the westernized healthcare system might want to take on, because if all of our communities had a higher baseline of wellness, it might be less scary to approach or to get in contact with COVID. It's still a very serious novel disease, but if our communities of color didn't have such a high disparity for our health disparities and as many barriers that we face, it wouldn't be impacting our communities at a disproportionate range. And I feel like a lot of our communities of color, our indigenous communities, have had an approach to health that was working for our communities before something maybe disrupted. And I think, yeah, a preventative approach would much more.
Great, thank you. Thank you. Huma, I'm wondering, you cover mostly, is it Washington state policy? I think, and correct me if I'm wrong, but how do you handle the federal policy and the state policy, what the crossover and the confusion perhaps?
Yeah, so we try to keep track of how the federal policies are going to be impacting Washington state policies. So there are some liberties states can take, and there's some discretion that states have in how they're going to implement different sorts of federal programs. But a lot of there are like federal policies that the feds have, discretion over, and then that impacts different things and different populations here in the state. For instance, like public charge. So that's one big confusing policy. And so that is targeting like federally funded public benefits. And so there's public benefits that are state funded. And so when people are choosing to disenroll from benefits, they may not even be the federally funded benefits, because here in Washington state, for example, Medicaid is just called Apple Health. Well, there's certain Apple Health programs that are funded by the state because we've advocated for expanded coverage for certain populations or for certain health coverage issues. And so we're paying for those through our tax monies. And so we have discretion over that, but people are still choosing to disenroll from that because they think it's just Medicaid. And then, yeah, that's just one concrete example I can give you. But yeah, we just try to keep on top of it, and we work with national partners to try and address things at the federal level that are going to have negative impacts on Washingtonians. So we do advocacy at both levels. So we did comments and did a lot of work with the Protecting Immigrant Families Washington Coalition around the Department of Homeland Security public charge rule. We worked with the Attorney General's office around like gathering some declarations in support of their motion for the preliminary injunction, which was later stayed, and so the rule went into effect. But things like that. So our focus is the impact on Washington state residents, but we do get involved at the federal level on policies that are gonna impact folks in Washington.
Are there specific communities that you work with in Washington, immigrants?
So our focus is on low-income populations, which includes communities of color and other disadvantaged populations. So it really is focusing on lower income folks.
And what are the struggles they have regarding COVID? What are the primary struggles you find that they have regarding the
yeah, just like
outbreak?
Like Giselle was saying earlier, so it's not just about access to testing and treatment, which is a huge thing. So like the cost of that, but also it's like the type of work that you're doing, you're at higher risk because you're doing like gig work. You're not able, like, you know, I'm lucky I can work remotely. We just shifted, you know, the way the org is operating. So everyone can work from home. We have the technology available. We have Wi-Fi and all of that. But lower income folks, they don't necessarily work in an organization or agency where they can do that so readily. And also, they may not be able to continue working. If they get ill, it's going to have a much more drastic impact on their funding or their monthly budget. And then, as Giselle was mentioning earlier, also some of these lower income folks aren't even eligible for like unemployment insurance or those sorts of things because of other factors like immigration status. And so it just compounds like the existing inequities and just makes it that much harder for those populations to be able to get through this sort of pandemic. The rest of us are complaining about being stuck at home and like those sorts of things. But when you think about like the impact it's having on other people who are concerned about being able to pay their rent or get food on the table, you know, it really dims the kind of concerns that other folks are complaining about, you know.
Yeah. Thank you. Giselle, there's a lot of people who are wanting to help, but not really sure how. You know, you're maybe at home working from home, but you don't know exactly how to get involved. Do you have suggestions for how people can help out?
I would say from our perspective, there's ways to help right away, which would be to help support the organizations to resource the needs that are out in the community. So whether that's donating some funds or volunteering your time, I think that's huge for the immediate moment. But there's also some long-term things that need to be done around advocacy and policy change so that we actually have changes that stick into the future. Thank you.
Mm-hmm. Yeah. Abriel, there's actually a question. I might as well jump here because I see it. Is HealthierHere doing any outreach to African American / Black communities, as they are extremely overrepresented in Seattle's homeless population and in our nation's COVID deaths?
Thank you for the question. The answer is absolutely. HealthierHere, I'm not the only community engagement member at HealthierHere. We have a team, and I have a team member who shares the exact same title as me, and she is also a community and tribal engagement manager. Her focus is for broader community and community-based organizations all across King County. And my focus is the tribal governments, the tribal nations, and Native-led community-based organizations. HealthierHere, before COVID hit, went through a very extensive partner selection process where we tried to ensure that we had representation from all race or ethnicity based organizations, as well as even distribution for our organizations across geographically across King County, to ensure that we are able to touch and build relationships with all the different age groups, race, ethnicity, sovereign nations, to ensure that we weren't excluding anyone and we weren't perpetuating health disparities.
Mm-hmm. And a follow-up to what I already asked Giselle, what can people do to help, either as allies or otherwise? What can people do? What would you suggest?
From an American Indian Alaska Native lens, I would have to ask the community to respect tribal border closures. A lot of our tribal nations are closing their borders to the general public, and that's their right as a sovereign nation. Some community members are not respecting that sovereign right close the borders. And they're doing that to try to ensure the safety of their community members, to ensure the safety of our elders and our knowledge keepers. There's already some tribal nations across the country already have live in food deserts, and so it's hard enough to try to get food into reservation spaces while operating under border closures. But if general community is entering or not respecting that boundary, then it just makes it that much more difficult to protect our tribal members. I would also ask the community to support policies which promote using traditional medicine, promising practices, or practice-based evidence. All of that is supportive of our preventative medicine for our community members. It allows us to continue our cultural practices and what we, our way of overall wellness. I'd also like, similarly to Giselle's, to ask the community, if you are representatives of organizations, if you have access to funds, please don't forget the Native-led community-based organizations that are on the front lines doing this work. Please try for unrestricted or low barrier access to those funds, because a lot of our communities are already trying to apply for grants, and the administrative burden of trying to track all of those different requirements adds to the problem of COVID, because then we don't have the time for our frontline workers to actually respond. And if some of you out there that have access to those funds don't know about some of the Native organizations, there's United Indians of All Tribes Foundation, there's Chief Seattle Club, there's Unkitawa, there's Seattle Indian Health Board, there's Tribal Cowlitz Health Center in Tukwila, and Mother Nation. And lastly, I'd like to ask the entire public to please don't bulk buy in fear, because a lot of our communities, a lot of those that are facing health disparities or those that are low income can't buy in bulk. And so everyone else, you know, recognize our own privilege, and please leave that space for those that don't have that privilege to buy in bulk as much, because then it leaves less resources for them, which only trickles down to them not having healthy food. It leaves them in fear and anxiety, which affects our emotional stress. It affects our mental health, which ultimately lowers our physical wellness baseline, which makes them more at risk if they do come in contact with COVID. So please don't, it has a trickle effect. Please don't fear bulk buy.
Great, thank you so much. Huma, there's a question here from an attendee about reopening us. I don't know if you have any thoughts on this, but what is the case in Washington? Do you think we will be open anytime soon, as President Trump has said for the whole nation?
Well, I think Governor Inslee put it well in his press conference yesterday, or maybe it was just a statement he had released, but that we'll assess, you know, when and if Washington State will be ready, and we're not going to do it too soon just to get the economy going, which is important, but also we're not going to be able to move forward if we just have a resurgence of cases. And so my personal thoughts on that are aligned with what the governor mentioned in his statement. And so I think, you know, this is having a big impact on a lot of communities economically, but also we need to think about the health and safety and well-being of our communities in our state. And so reopening the economy, or, you know, just going back to business as usual, these are unusual times, and so they call for these sorts of precautions.
And to follow up with the other speakers, what can people do to help? How can people get involved, especially from a policy advocacy point of view?
Sure. So I think staying informed is really important. There's a lot of information coming from Department of Health, King County Public Health, the governor's office, lots of different governmental agencies. And so staying informed about what's going on, and also, getting involved and sharing your opinion about where funding should be allocated. There's a lot of funding that's going to be coming from the federal government. These disaster relief funds and things, and there's a lot of discretion left to states about how to allocate that funding. So if you think it should be spent on healthcare for folks who don't have access to healthcare, let your state legislators know, let the governor's office know. Also, in terms of like establishing a state-funded sort of like uninsurance or unemployment fund for folks who aren't eligible for the federal unemployment program due to immigration status, these sorts of things. So it's important for folks to, share their thoughts on that rather than just being passive and complaining about where the funds are allocated, which a lot of us end up, doing. And then just like volunteering, like Abriel and Giselle said, if you have the capacity to do that or to share, donate funds. I know a lot of orgs are asking folks to, this check that some of us will be getting for $1,200. If you don't really need that, there's a lot of orgs that could use that to help their constituents and community members. So I have seen quite a few letters going out asking folks to donate some or all of that if they don't need it themselves.
Great, thank you. So this question is, I think, for all of you, but I'll start with Giselle. It's from Esperanza. It's kind of long, so bear with me. COVID-19 is exposing the disparities in healthcare, employment, education, etc. So when we talk to going back to quote unquote normal, and normal has never worked for people of color and those living in poverty, what ideas, suggestions do you have for how we implement and sustain changes in the systems and structures that impact our lives? Giselle, I know it's a big question.
Thank you. I would say that it's actually important, like Huma said, to be informed and then get involved. The only way we're really going to see lasting change is through the advocacy and policy work, but we all have to be involved, and we have to speak up. And there's lots of opportunities now to be able to do that to a certain degree, but not to ever stop. As some people do it when there's the urgency occurring, and they don't stick around. And so we need to make sure that folks continue to support the change that we want to make sure occurs for our community.
And how can they do that? How can they speak up with these systemic issues that we have? Do you have any suggestions?
Well, this is my perspective would be to definitely make sure that you are getting connected with the organizations that are leading the work, such as Northwest Health Law Advocates, HealthierHere. There's, for example, just in this week alone, we've had a couple of sign-on letters for nationwide impact with the Protecting Immigrant Families Network, and then another one that's going to the governor for Washington State specifically, to try to really call out the injustices that are occurring so that we can have change quickly to hopefully see some better opportunities for our community now. But that's why I say you don't want to stop right now. You want to make sure that you stick with it and continue to be involved and inform yourself. But there are lots of great organizations, and I would say that Northwest Health Advocates has been doing this for a really long time, so making sure you're getting connected with those key groups. And even if you're just signing up for the email listserv, just to start getting informed about what are the concerns that are happening, how are they being addressed, and then supporting those organizations and being involved.
Thank you. Abriel, how would you respond to that question about, like, normal never really worked, so how do we go back to a new normal, especially with systemic issues?
yes, normal never really worked. And it's clear that COVID's highlighting some of those gaps. So I would say that we need to, as people are paying attention now and we're making these moves towards things that we've been talking about for years, like telehealth is now available, and I think that was being discussed for years prior to it. We need to make sure that we are ensuring that funding for things that are being tried out, things that are being attempted as we're approaching this novel virus, and we're willing to try things that we've talked about, making sure that as those things are working, as we're taking preventative measures, that we're also remembering to fight for that funding, to show that the preventative measures work, to make sure that this funding isn't funding that's available now or that's going towards some of these attempts isn't lost afterwards. Because if it's working, if it's reflected that it's lowering the bell curve, data that's showing that something isn't present, such as a COVID virus among certain communities, what was it that was helping? What did we try that was helping, that was making that not present, right? That it not being present is data of something working. So the community-based organizations that maybe are making these attempts, that are trying things, making sure that you're recording how many families aren't getting it while you're doing this practice. And like I said earlier, a lot of these, I heard that a lot of these families that are receiving traditional medicine care packages aren't reacting or aren't symptomatic of the COVID virus, right? That's data.
Mm-hmm.
And that's supportive that these approaches do work. And so coming into a new normal could be coming into preventative care.
Mm-hmm.
So that would be my hope, and that's what I hope we're doing right now, is tracking what's working and being willing to fight for that funding to make sure it's not a one and out, not one and done, not we'll do it while there's an epidemic going on, but not funded afterwards if it was working.
Great, thank you. Huma, what would you say about that question? How do we go to a new normal when the normal hasn't worked?
Yeah, I think I don't have much additional to add. I just echo their comments, but just that this pandemic really has shed a light on what wasn't working and why it is so important that everyone have access to basic services, including healthcare, nutrition, and things like that. Because, you know, a public health crisis is just that. The whole community is impacted if one segment of the community is unable to access the care and services that they need. You can't just write off a portion and think that, you know, that's not going to impact the health of the rest of the state or country. You know, it does. And so I think this is really shedding a light on that, and really these conversations that we've been trying to have for years, like now is the time to really have those and continue to have those after, you know, this issue resolves, hopefully.
Thank you. Giselle, I'm not sure, well, we'll see if you're the one to answer this question. Question from Annie. Are panelists seeing particular impacts of COVID pandemic on pregnant, birthing, and postpartum families in their community? Do you have any thoughts on that?
I have heard some concerns. I wouldn't say that I've heard a lot, but definitely in terms of whether the being pregnant puts you at higher risk, whether the baby will also get COVID-19. And so it's fears that that continue in the community in general, and wanting to make sure that our pregnant women and babies are healthy.
Mm-hmm. Abriel, how about you? Have you noticed more impacts through HealthierHere on pregnant, birthing, and postpartum families?
I've heard through some of the doula programs, like the one at United Indians of All Tribes Foundation, is that it's definitely impacting the the supports that our prenatal mothers are getting or not getting. So the doula, I have heard that a doula provided virtual, over the phone, FaceTime supports for a birthing mother for 14 hours because there was only one family member allowed in the room during birthing at that time, and the doula believed that it should be a family member, but that also impacts that mother's mental health going into that, and emotional health, because having this individual there supporting you through your entire pregnancy, especially if it's your first pregnancy, and then not having them there to help support you, is emotionally distressing. And you may still have a family member there, but this doula who has generations of knowledge that have been passed down and traditional methodologies isn't physically able to be there for you, which puts stress on the entire delivery. So it's definitely impacting our doulas not being able to be in the room. It's definitely impacting the supports that the mothers are getting, and so it's definitely impacting mental and emotional distress, which affects our physical baseline for wellness.
Abriel, this might be a question for you as well, from Jordana. She says, I would like to know how we can better help our Asian Pacific Islander community since they have suffered with discrimination, xenophobic actions, and racism.
For my fellow Indigenous brothers and sisters from the Polynesian community, I would say that we need to listen to them the same way that I would advocate that we listen to our Indigenous people from the land here on the mainland, on Turtle Island. That we need to listen to them about what works for their community. We need to listen and support and get them the tools that they need, and then get out of the way and let them do it. You know, they know what's best for their community. Each of our communities are living this. We're living day in, day out these health inequities, these health disparities. We live this every single day. We see our family members go through it. We know exactly what we need. We know how to heal our own communities. We know how to heal our hearts. We know how to heal the historical trauma in our DNA. We know how to break that chain. So our policymakers, our community, our government needs to listen to our communities about what works for us. Each community has something that works for their own community. We all have our own traditional medicines. We all have our own health practices that work for our community before westernized medicine maybe come in and disrupted it. So what was working for our communities before something was disrupted and put us down this trickle path of health disparity, one health disparity after another, and inequities in resources. So we need to get the resources to the communities that they ask for and let them take care of their own community.
Thank you very much. Looks like we've reached almost 2 o'clock, the end of our time. So I really want to thank all of our participants who signed on. I want to thank our panelists. Thank you very much. I want to thank our staff for helping out behind the scenes. And actually Alaska Airlines, who is our Civic Bootcamp supporting partner for sponsoring all of these webinars. And as a reminder, we have a free virtual Civic cocktail coming up on May 6th with former Governor Gary Locke and another guest to be determined. And soon after this, we close on this, we'll be sending all the participants a short survey, letting you give us feedback on what you heard and other ideas for future webinars. So, and I will pass on, if you are okay, panelists, your emails to participants, and definitely your websites and such, so they can get in touch. And I really appreciate having you on. I think it's been a great discussion, and thanks again.
Thank you.
Thank you.
Haishka, Nlashtish, thank you.
Thank you.